Back pain when bending over, causes and treatment. There are many different causes of back pain when bending over. Stiffness and minor pain may be a sign of muscle strain, while severe shooting pains could indicate sciatica. A herniated disc can lead to weakness and numbness in one or both legs. Back pain when bending over is a common complaint of many American adults. It can occur due to problems with the muscles or other structures in the back. Placing increased pressure on the lower back due to improper bending and lifting can worsen symptoms. As such, using proper lifting and bending techniques, as well as other strategies such as certain medications, rest, and supportive devices can help to minimize back pain. Causes. Almost 40% of adult Americans experience some degree of back pain, and evidence suggests that roughly 80% of all people will experience lower back pain within their life. Some causes of lower back pain when bending can include back muscle injury. Injury to the ligaments and supportive muscles around the spine can cause back pain both during movement and at rest. Bending can put significant pressure on the lower back, causing the muscles and ligaments to stretch excessively. Damage to muscles surrounding the spine can also cause inflammation, leading to muscle spasms. People commonly use the term back strain as an umbrella term for muscular injury around the spine. Other symptoms: stiffness in the lower back, muscle spasms, difficulty maintaining an upright posture, and a limited range of motion can all indicate a lower back strain. Treatments: resting the back for 1 to 3 days can help reduce muscle pain, as can taking non-steroidal anti-inflammatory drugs. Some over-the-counter options include ibuprofen and naproxen. However, it is important to note that while resting can be beneficial, bed rest is not advisable and may contribute to further stiffness. Massage, applying ice and heat, and using electrical muscle stimulation therapies may also help. Physical therapy exercises and staying active can strengthen the back and help prevent further injuries. Herniated disc. Disc between vertebrae act as shock absorbers and help stabilize the lower back. A herniated disc slips out of place and puts extra pressure on the surrounding nerves. This can be the result of a sudden injury or trauma, or aging-related changes that cause the disc to degenerate, making it easier for them to shift. Other symptoms: a herniated disc can lead to weakness in one leg and numbness in the legs and lower back. Rarely, a person with these symptoms loses control of their bowel or bladder functions. If this occurs, seek treatment immediately, as incontinence may result from a serious underlying condition. Treatments: resting the back for a few days, taking non-steroidal anti-inflammatory drugs, then slowly becoming mobile again usually helps. Some people find relief from steroid injections in the space around the nerve, as this can relieve inflammation. If symptoms are severe, the doctor may recommend surgical intervention. Sciatica. Sciatica is a condition that can result from a herniated disc. If the disc presses on the sciatic nerve in the lower spine, it can cause sensations of pressure, burning, or severe pain that travels from the lower back down on one or both legs. Other symptoms. Sciatica can also limit the range of motion in one or both legs. If someone has sciatica-like symptoms and loses control of their bowel or bladder, they should seek medical attention immediately. Treatments. A person may require surgery to remove the part of the disc pressing on the nerve, though this is rare. The American Academy of Orthopedic Surgeons estimates that sciatica goes away without surgery in 80 to 90% of people with the condition. Non-surgical treatments include applying ice and heat, movement and gentle stretching, exercises to relieve inflammation. Spondylolisthesis. Spondylolisthesis is a stress fracture in a spinal vertebra that often occurs in younger athletes, such as those who play football or do gymnastics. It occurs when the fracture of the vertebra breaks and causes the vertebra to slip forward due to instability. Other symptoms. A person may also experience pain in the buttocks and thighs, as well as pain that gets worse with activity. Treatments. For spondylolisthesis, it is important to rest and avoid activities that put pressure on the lower back. Some people also benefit from physical therapy and a brace to support the back during physical activity. If the injury causes severe symptoms, the doctor may recommend surgery. This could involve spinal fusion, a procedure that secures the spine. Arthritis. Many forms of arthritis can affect the joints in the back, causing pain. Osteoarthritis. Osteoarthritis is the gradual degeneration of cartilage and bone in a joint, causing inflammation. This can affect all joints in the body, including the back. Rheumatoid arthritis. Rheumatoid arthritis occurs when the immune system mistakenly attacks tissues in the joint. It typically occurs in the hands, feet and knees but can affect the spine. Ankylosing spondylitis. This is a chronic inflammatory condition that affects the spine, particularly the joints near the pelvis and hips. It can result in pain, stiffness and other discomfort when a person bends over. Arthritic conditions can worsen over time. For example, degeneration from osteoarthritis may progress as a person ages. Rheumatoid arthritis, ankylosing spondylitis, and other inflammatory forms of arthritis can lead to the bones in the spinal joints fusing. Also, when it is severe, ankylosing spondylitis can cause changes in a person's posture, giving them a hunched appearance. Other symptoms. A person with this condition may also experience pain when they press on their lower back and the area above the pelvic bones. Treatments. Treatment may initially involve taking non-steroidal anti-inflammatory drugs. If symptoms worsen, a doctor may prescribe other medications such as tumor necrosis factor blockers, which help reduce inflammation. In addition, some people find that physical therapy helps improve their flexibility. Self-care tips. Correct lifting and bending techniques can help minimize back pain when bending over. These techniques include bending at the knees and hips instead of at the waist, avoiding twisting the spine when bending to reach for something, keeping the feet firmly planted shoulder width apart to reduce the risk of falling forward, refraining from carrying objects that are too heavy, for example, by taking multiple trips and using assistive devices such as rolling carts, carrying objects as close to the body as possible and holding them at waist level. In addition to practicing injury prevention techniques, a person who has back pain when bending over can also try these self-care measures, taking over-the-counter non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen to relieve pain and inflammation, resting the back for a few days when engaging in gentle stretching exercises and low-impact physical activity such as walking, wearing a supportive device such as a back brace to prevent discomfort. When to contact a doctor, a person should seek immediate medical attention if they are unable to move any muscle or joint in their lower extremities, or if they lost control of their bowels or bladder. Any of these situations constitute a medical emergency that requires first treatment to prevent further nerve damage. If back pain worsens despite home care or does not resolve within 2 weeks, it may be a good idea to see a doctor. The doctor can help determine whether to consult a physical therapist or a specialist such as an orthopedic doctor or a neurosurgeon.